now we're moving on to special tests. So the first special test is a wall push-up, which is basically the same as it sounds. You just go against a wall and then push, and just do a push-up against the wall, and that tests for a weak serratus anterior. And then the next one is Apley's 1, which checks for range of motion. So for Apley's 1, you would do internal rotation, adduction, and then extension. So it would look like this. And then if it was on another person, you would mark where it is on the back, and then do it again with the other arm, like this. And then you would mark to see where it is on the back, and then you would compare them to see if you have the same range of motion in both arms. Now that's Apley's 1. Apley's 2 is basically the opposite. So you do external rotation, abduction, and flexion. So it would look like this on the back. And then, so just like Apley's 1, you would do the same thing on the other arm. So I would do that on the other arm, and it would look like this. And then you would just check the range. You would check the placements on the back to make sure that it's around the same, so that they have roughly the same range of motion. Okay, so now on to glenohumeral laxity tests. So first, I don't have another person, so it's kind of difficult to do this kind of test, or the apprehension test, but basically what you do for it is you have the athlete lay down and then have their arm like at an angle. And then what you would do is you would weave your arm through and then like have your hands like this. So you'd weave your arm like that and then have your palms touching. And then you put pressure on their elbow to test if they have glenohumeral like apprehension. And then next, for the posterior drawer, what you do is, it's kind of easier to show this one, but basically you have the athlete have their elbow at a right angle to their body, and then you as the trainer would push down, and then if anything pops out back here or the athlete feels apprehensive, then that is positive for glenohumeral laxity. And then another way to do this to make sure that you have the right result is to have them internally rotate their arm and then push down again. And then same thing, if anything pops out the back or they feel apprehensive, then they're positive for glenohumeral laxity. And then sulcus is for inferior laxity, and what you do for sulcus is you would pull down the arm, like the upper arm, like this. You would pull it down, and then you would dig your finger between the acromion and the humerus. So it would kind of look something like that, and then you would just like dig your finger in there, and then that tests for inferior laxity of the glenohumeral joint. Okay, so now we're on to the fourth acronym, which is HEAD. HEAD stands for Hawkins-Kennedy, empty can, active impingement, and drop arm. So first is Hawkins-Kennedy. These all test for the supraspinatus, by the way. First is Hawkins-Kennedy. Basically, you just go like up like a hawk and down like a Kennedy. And then I'm the athlete and the trainer. So like the athlete would have their arm like this, and then you would just resist a little bit. And that tests for supraspinatus impingement. Second is empty can. You're basically just have your hands out at a 30-degree angle. 30-degree angle, and you're basically pretending like you're emptying cans. And this tests for supraspinatus strength. And then the third one is active impingement, which is it's basically just ranges of motion and tests for supraspinatus impingement. So you go like that. Hold on, you can't really see it. So you go like that, and like that. And so you're putting the backs of your hands together like this. And that tests for supraspinatus impingement because it's going over the greater tuberosity. And then the last one is drop arm. So this is exactly what it sounds like. You just lift your arms up first 20 to 30 degrees of abduction, and then if they have this test for a supraspinatus tear, and if the athlete has a supraspinatus tear, they wouldn't be able to lift their arms up like this. And then also, if they can do this, but it appears that they're struggling, you just do a little tap tap, and if it falls, that's also positive for a supraspinatus tear. Okay, now for SCLOI, which are the last 5 special tests. First, you have speeds. So basically you're in anatomical position, you do flexion and then resist, and if they have pain up by the bicep area, that means they have bicep tendon pathology, which is basically just tendonitis of the bicep tendon. Next is compression. So you take arm across the body. You take your arm across the body, and if it hurts, like right here, sort of midway through, that means it's an AC separation. But if you keep going farther, and then it starts hurting even farther, that means it's an SC separation. And then liftoff is, so you put your hand behind your back like this, and then you just try and lift off the hand off of the back like this. And that tests for a subscapularis tear. And then the next one is O'Brien's, which is you put your hand across you put your arm across your body with the thumb down and then resist. And then this tests for slap pathology. And then so you go thumb down, resist, but then if you go thumb up and it doesn't hurt, then that's still slap pathology. And then the last one is Jorgensen's. So Jorgensen's also tests for bicep tendon pathology. So basically, this one is also kind of hard to do without another person, but the athlete is going to try and supinate their hand on your arm, basically, and you're going to be like holding your arms, the trainer and the athlete's arms are going to be like this. And then the athlete is going to try and supinate their arm across your arm. And then you're on the arm that they're using to supinate, you're going to be feeling their bicep tendon to feel if they tell you there's any pain or if you feel anything abnormal. So Jorgensen's tests for bicep tendonitis or bicep tendon pathology, and that is the last of the special tests. So this is active resistive testing for the shoulder eval, and it's going to be kind of hard since I don't have another person, but I'm going to do my very best. So flexion, concentric, you just be like push against me, and then you would go up, and then resist me, which is concentric, and then at the top, be like resist me. And then extension, you would do the same, apply pressure on the back, and then all the way up and be like push against me, push against me, push against me. And then once you're at the top, be like resist me. And then for external rotation, you're going to do the same thing, concentric, push against me, push against me, push against me. And then once I get to the back, resist me, eccentric. And then for internal rotations, concentric, push against me, push against me, push against me, and then eccentric, resist me. And then next is abduction. So for concentric, push against me, push against me, push against me, and then at the top, resist me, eccentric. Adduction, concentric, push against me, push against me, push against me. At the bottom, resist me, eccentric. That next is horizontal adduction. So it'd be like push against me, push against me, push against me, push against me, concentric, resist me, eccentric. Horizontal abduction be the opposite. So push against me, push against me, push against me, concentric. Then once you get to the back, resist me, eccentric. Then elevation, what you would do, these next 4 are a little different because they're having to do with the scapulothoracic joint. But elevation, you just be like push against me, push against me, push against me, concentric, eccentric, resist me. Then depression, you would hold the elbow like this and be like, push against me, push against me, push against me, push against me. Or you would be like, push against me, concentric, and then eccentric would be resist me, and then protraction, you're going like this. So push against me, push against me, push against me, push against me, concentric, eccentric, resist me. Retraction, kind of hard to do, but so we start in protracted, so push against me, push against me, push against me, push against me, concentric, and then resist me, eccentric. And then after those, you do your closing statement. So in my opinion, there's nothing wrong with this athlete. And that's it. The shoulder eval is done.